Hello everyone, this is Dr. Nasser, and in this clip we are going to look at the blood film and try to discover what may be abnormal in this smear. At the first glance, we do see some abnormal morphology, echinocytes, they are present here. Now, whether or not they are true echinocytes or an artifact for late slide making, we don't know that. But they are present here, and I would in this case report the echinocytes at least 1 plus or 2 plus even. There may be some target cells present, slight polychromasia. Platelets appear to be normal. There are artifacts around the field. They may not be artifacts actually, because up here I denote Al-Jolly body in the red blood cells. So they may be the remnants of those Al-Jolly bodies. That's a possibility. There is a neutrophil here, appear to be normal. It is a segmented neutrophil, even though at the first glance it appears to be a band. However, there is a fold in here, and I do believe this is a segmented neutrophil. The granulation of the cytoplasm also confirms that hypothesis. But the most important finding of this slide right now is the presence of this structure. This is malaria. This is Plasmodium malaria at the Schizont stage. Malaria is a parasite that is being transmitted by a female Anopheles mosquito. More than 3 billion people on Earth today live in the area in which malaria is endemic. So it is a major problem. One of the major causes of death in Africa is malaria. One of the primary causes of death in children is malaria. So identification of that, it is important, but there are different malaria species. There are 5 different species, and each species, even though has an overall similar cycle, they present themselves differently on the blood smear. And it becomes very technical to be able to identify the exact species of the malaria because the similarity and differences that they have in different stages. This stage is the Schizont stage, in which the parasite is getting ready to break the boundaries of that red blood cell that was infected, and the reason that it appears like that because it's devoid of hemoglobin, because the parasites have used up all the hemoglobin. So the parasites mature, and in a cycle, depending on the species, every 12 hours, 18 hours, they are going to release the newly formed parasites, and each of those parasites can infect another red blood cell, and this process propagates until the patient dies or the patient is able to survive and develop immunity. In any case, this stage is part of the development of Plasmodium malaria. Looking for these abnormalities you should be very patient with the process. Don't expect the first 2 or 3 fields to be able to find a malaria parasite. You have to be patient. You have to go meticulously through each field. Of course, patient history would be of tremendous help in this case. because then you can make thicker slides. That's going to increase the chances of detection for malaria. But in here, we also see another Schizont stage. There's a platelet on this side. There's a Schizont Plasmodium malaria. This is an artifact. This could be Plasmodium related, but it could be also an artifact. This appears to be, if I use that, it appears to be a Hal-Jolly body, which again, people with malaria infection can develop splenomegaly, and perhaps the presence of Hal-Jolly bodies could be indicative of problems and stress on the spleen. So this is a very important finding, and it should be noted very clearly to the physician and usually sent for confirmation for the species using polymerase chain reaction PCR to be able to exactly identify what species of malaria it is. So I would not include the exact species in my report, but I can always indicate I suspect, but PCR confirmation is required.